Welcome to the American Relief Act video podcast series part 1 on Health and Human Services, hosted on Government Technology Insider. I'm your host, Matt Langen. Agencies that make up the HHS sector of state and local government serve some of our most at-risk citizens. And sadly, COVID-19 increased the number of individuals served by these agencies, further straining the resources available to really help them. And it's never been more important to provide innovative solutions to the challenges facing these agencies today. So providing a hybrid modern government platform rooted in on-prem and cloud infrastructure and solutions is the strategic direction that HHS agencies really need to follow. And data is always at the core of any HHS solution and can be the key that unlocks effective human services delivery methods. And today we're joined by Bob Nevins, who's the Director of State and Local Government Strategy at Oracle Government and Education, who will discuss this further. And Bob, thanks for joining us today.
Sure, great to be here, Matt. Thank you.
Yeah, likewise. Let's go ahead and kick it off and let's talk about hybrid. So why is the hybrid approach so important for HHS agencies today?
Yeah, HHS agencies, they tend to take kind of a long road approach to modernization, and that's not such a bad thing, really. What this means is that they're likely going to run some of their applications in an on-premise environment for some period of time, and maybe forever. And then they're going to pick and choose those applications that they're going to run in the cloud and truly modernize. They have very complex programs, and really what that means is that they're really sensitive about the data that they have in their possession. And letting that data repository outside their own firewalls kind of makes them a little bit skittish. So for that reason, they're probably going to run some applications in their own data center for some period of time. And that's good for us, actually, because Oracle offers a cloud at customer solution, which enables them to kind of get the benefits of the cloud, to keep it behind their firewall so their data doesn't have to go outside their four walls. We're also one of the few companies that offers solutions that work similarly, regardless of whether you're running them on-prem or in the cloud. So we really are all about the hybrid solution for our agencies, and we think it's a really good fit for Health and Human Services in particular.
Yeah, that's great. And you touched upon data, and let's dive into that a little bit more. So why is data really important for this sector?
Well, in HHS, it really can mean the difference between life and death. Data is really important. When you think about some of the programs run within HHS, you have child welfare, in which you try to keep children protected from neglect and potential physical harm. And that's an enormous responsibility. So it relies heavily on the collection and analysis of data and information from all aspects of a child's life: school, daycare, healthcare settings. And the same is true for all health-related agencies, and HHS Medicaid agencies need to economically manage their medical costs by assessing ways that they can use data to avoid emergency medical services, which are very costly, and perhaps to use that data to come up with more predictive models and more health programs for people at risk, so that they can be managed and avoid emergency type of situations. So that data is incredibly sensitive, but also incredibly important for carrying out the mission of Health and Human Services.
That's great. Thanks for those insights there. And let's switch over and talk about citizen engagement tools. What's available out there? Chatbots, online processing, all that good stuff?
Yeah, so all that stuff. Chatbots certainly, one of the main citizen engagement tools, but there's a lot of others. And agencies are really beginning to recognize the benefits of modernizing their IT platforms. And the pandemic, quite frankly, shined a very bright light on that need. So the need for more low-touch and no-touch means of gathering information from customers is becoming very important. Most programs rely really heavily on data collection in order to determine eligibility. And the days of a kind of an in-person or over-the-phone interview to collect that eligibility information, they're over. So agencies don't have the staff to do it. In addition, customers really have become accustomed to interacting with chatbots in other areas of their life outside of government. So they have that same expectation for government. So it's really becoming much more prevalent in the Health and Human Services world and government, actually, government-wide.
Oh, that's great. Let's stick in the vein of data, but let's talk about data sharing. So what can data sharing, especially among agencies, do for enhancing service delivery?
Well, I touched on eligibility, and that's kind of a key one. There's a huge need to share information amongst agencies. In the past, many benefit programs had their own eligibility systems, and that was pretty inefficient. So now states are beginning to develop what are called integrated eligibility systems. And what that requires is that agencies share data and they build eligibility systems that then can work and benefit all of the recipients. And many of these recipients, are the same recipients that receive, for example, food stamps and cash assistance and maybe some energy assistance in the form of LIHEAP. So having this integrated eligibility system is really important. In addition, data sharing is becoming a much more important topic now that data ingestion, data mining, and data analysis tools have improved. Agency heads are now eager to kind of answer the questions that they didn't even know they needed to ask. And they can do that with the ability to kind of gather all this data and use it to kind of design new programs and maybe modify existing programs to be much more targeted. Budget's always an issue for these agencies, and they need to try to do a lot more with less. So they're looking for any angle they can get to really fine tune their programs and get after those people that are most in need.
Yeah, that's great. And, also, Bob, I see all the time in the government IT trades and the health IT trades, artificial intelligence and machine learning. It's certainly a hot topic these days. So from your perspective, how can AI and ML really impact HHS agencies?
Well, it's interesting you mentioned that, Matt, because we are working with a state right now to implement a solution that would use AI to determine trigger factors for substance use disorder. And, the potential is there to implement these data analysis tools and really identify what are the key triggers that lead to substance use disorder, so that they can design programs to avoid it up front or know exactly where and when to address the issue. And it's really done through deep data analysis, data visualization tools, and the ability to leverage artificial intelligence for the benefit of their constituents. So it's really going to become much more useful across the country in the HHS realm. I think it just takes a matter of 1 or 2 or 3 examples for other states to kind of open their eyes and say, oh, wow, this really can make a difference in my program.
That's great. Well, thanks, Bob. And this concludes the American Relief Act video podcast series, part 1 on health and human services, hosted on Government Technology Insider, where Bob Nevins, who's the director for state and local government strategy at Oracle Government and Education, discussed how a hybrid modern government platform really is the key that unlocks effective human service delivery for HHS, and much, much more. And Bob, thank you so much for your time today.
My pleasure, Matt. Thanks very much.